Great to have you tuned to the network service of Radio Nigeria. The program is Spark. Spark is a program brought to you by the International Center for Investigative Reporting, supported by the International Budget Partnership, to tackle pressing issues in our nation around unequal maternal health services, gender-inclusive agricultural support for small-scale women farmers, access to loans, among others. I'm your host, Blessing Ebireri. We dive into the realities of the Basic Healthcare Provision Fund, BHCPF, for vulnerable mothers, focusing on how it reduces out-of-pocket costs for women like you. Established under the National Health Act 2014, BHCPF channels funds to primary health centers, PHCs, offering free or subsidized basic services including maternal care, emergency treatment, and support for pregnant women. Imagine a mother facing childbirth without draining her savings. This fund makes it possible by covering essentials like drugs, vaccines, and obstetric emergencies. But what are the real stories? Joining me now to share expertise on the realities of BHCPF for vulnerable mothers, reducing out-of-pocket costs for vulnerable women, is Filade Olaniyi, the State Treasurer, National Association of Nigerian Nurses and Midwives, FCT Council. You're welcome to the program.
Thank you for having me. It's a pleasure to be here.
And to you, our esteemed listener, the telephone lines to make your contributions are 0915 091 0482 or 0915 091 0483. You can send your questions on WhatsApp to 0810-250-7579. I'll take that again, 0810-250-7579. We're also live on Facebook at the ICIR. Don't forget to include your name and location. It's great to have you join us today for the program, Filade. Thank you so much for coming. Let's just dive into what we have for today, BHCPF. And how does this Basic Healthcare Provision Fund, how is it designed to support vulnerable mothers?
Thank you very much, Blessing, for having me here. Thanks for the opportunity. Basic Health Provision Fund is actually an initiative of the federal government, just like you have said, and it was actually designed to address these out-of-pocket expenses, particularly for vulnerable groups. It was designed to address issue of antenatal care, poor women in the society, and a number of other things, antenatal, postnatal, and a number of commonly found disease conditions in the rural setting. And it is specifically designed to address any obstetric emergencies, so that it won't be because there is lack of fund or there is inadequate facility that is causing maternal and child health mobility and mortality. And it was designed to have that. And the way the whole program is designed in such a way that funding wouldn't be an issue.
Okay.
Because it's directly from the budget, and it is from federal government straight to the grassroots where these resources are needed. That is how it was designed.
Okay.
But when you look at the whole implementation of the whole thing, is another different game. We have a beautiful design, but when it comes to implementation, that's where we have the challenge.
Okay.
And one of the major challenges there, like I used to say, even on this program, that government of the day believes in investing in infrastructure. When I'm a governor, I built this, I constructed so number of hospitals, number of health facilities. But one of the major problems with this basic care is the manpower. The manpower are not just there in many of our health care centers, particularly in the rural areas. Even if you take FCT for instance, FCT has a lot of primary health care centers, but we don't just have the human resources. When we talk about human resources, we talk about skilled birth attendant nurses, midwives, and other frontline health workers.
Okay.
They are not just there. And if those manpower are not there, there is no way we can deliver a quality health care, particularly to achieve the aim and objective of basic health care provision fund. Even if you have the fund, but you don't have the other resources available, the aim will still not be achieved. And that's one of the major conditions, the major challenges bedeviling this laudable initiative of government.
Okay, despite BHCPF being in place, many vulnerable women still pay out of pocket.
Yeah.
So what are the main reasons for this gap? I know that you mentioned implementation of the fund itself, talked about manpower.
Yeah.
What are reasons for this gap?
Well, one of the major reasons for this gap, I may say, is even the awareness is not even optimal. Because I want to believe that many of our women in the rural settlements, they are not aware of the fact that there is free healthcare services. That, as a matter of fact, when you want to deliver, when you are pregnant, or when you are to receive antenatal or postnatal care services or emergency obstetric care services, you don't actually need to pay, because the funds are already there and the materials are there at all those PAC level. But unfortunately, because of this lack of awareness or limited awareness in our communities, women are still afraid that, since they are poor, they don't have the resources to pay for the services. So because of that, it affects the turnouts, it affects the patronage. So we have many hospitals who have the drug, they have the medication and other infrastructure required to deliver care. But because people in the community are not fully aware, it is one of the major challenges that is affecting the implementation of the program. And I want to believe with civil society, organization, media, and you and I, other healthcare professionals, I think we need to take this message to the doorstep of the community to make sure that all our people in the rural area are fully aware of this provision that this laudable initiative government has put in place to care for the citizen, particularly the vulnerable group.
The women.
Yes.
Okay, you said this funding for vulnerable women are free.
Yes.
Or is free rather.
It is actually free.
So it's free. You're not doing 10%, you're not doing 100%, you're not doing 90%.
As a matter of fact, the program is designed to be free. And if eventually you have to pay, you have to just pay a minimal cost. But as a matter of fact, any obstetric care services are designed under this basic health provision fund, it is supposed to be free. And
Okay.
like this said, but we can also rule out the fact that there are also Nigerian factors there. We have some we cannot rule out some of the sharp practices in the sector. And it is because it still boils down to lack of awareness of the women.
Okay.
Because if women are properly informed and they are aware that this thing is free, even if somebody is demanding certain amount from them, they will be able to categorically say that the government said this thing is free. And if they stand on their rights, knowing fully well that they have the right information at their hand, nobody will be able to tell them to pay any amount.
Okay. So now, like you said, it's totally free.
It's free.
So now what steps can all these vulnerable women take to register for BHCPF? What are the benefits, follow-up or documentation that is typically required?
As a matter of fact, all they need to do is to visit the nearest primary health care center closest to them.
Okay.
Because this fund is available to provide the basic infrastructure or the materials, resources
Sorry, please,
needed.
can you hold your thought? We have a caller.
Okay.
Hello?
Yes, hi, good evening.
Hello, good evening. Can you speak up, please?
Yes, please. Yes, my name is Dr. Viola Davidson from Budget Foundation calling in. Can you hear me?
No, I can't hear you. Can you speak up a little bit louder?
Okay, just a minute, please. Okay, I said my name is Dr. Viola Davidson and I'm calling from Budget Foundation. Sorry, can you hear me now?
No, I cannot.
Hello, can you hear me? I can hear myself echoing.
No, I can't hear you. Okay, so we're talking about how you can register to get access to this fund, and you said we could
Yes.
go to the nearest
nearest
PHCs.
care.
Okay.
Nearest to the.
Hello?
Hello.
Good evening.
Hello, good evening. Can you hear me?
Yes, I can hear you.
Please, what's your name?
Can you hear me?
I can hear you a bit. What's your name and where are you calling us from?
My name is Adam West. I'm calling from Suleja.
Okay, sir. What's your question?
No, the question is that the government is trying tremendously in the area of spreading this public primary health care.
Yes, primary health care service. PHC,
yes. But what I'm saying is the other thing that is happening is that most of the diagnostics facilities are there. The ultrasound and some other basic things like even laboratories, they no efficient laboratories that are functioning there. Just examination, then prescription of one or two drugs. I think it needs to be improved and then spread to rural areas, and then more sensitization should be carried out constantly. They shouldn't be tired. That's my own contribution. Thank you.
Thank you so much, Adamu, for calling all the way from Suleja. Thank you so much.
Thank you.
Okay.
Nearest PHs.
All right. Thank you, Adamu, for that your contribution. As I was saying, it's important every woman pregnant or whoever need healthcare services in the rural area, all they need to do is to visit the nearest healthcare facility, specifically primary healthcare centers, where they can actually receive care. With the facilities our government has put in place to ensure that the community receive the quality healthcare, they don't need any fund, any money, any fee to pay to access this healthcare service that is being made available at the rural areas.
Okay, thank you for that, Philade. What are the main delays in fund releases to these PHCs?
Well, one of the major things is the bureaucracy in the government system. Okay. You know, the procurement process is another different ballgame. And even when it's procured, even the disbursement of all these the resources, these materials, resources, the drugs, vaccine, and all that, you know, the supply chain, the distribution chain, all these processes sometimes because of the bureaucracy in government system, it doesn't make the things to work as expected. And so if government can actually improve in that area, it will make sure that at least these drugs are there. It may interest you to know that some of these drugs that are there, because of this low patronage at the rural setting, some of these drugs that are procured by government got expired. And once they are expired, it's like they are no longer useful. And so that is why before those drugs get expired, it's important that the rural communities patronize these healthcare facilities so that they can actually utilize, take advantage of these available resources to take care of their health needs.
You're tuned to the Network Service of Radio Nigeria, and the program is SPARK, brought to you by the International Center for Investigative Reporting and supported by the International Budget Partnership. We have been discussing Basic Healthcare Provision Fund, the realities of vulnerable mothers. We will go on a short break now. When we return, we'll be taking your calls for questions and contributions. Please stay tuned.
To tackle pressing issues in our nation, such as unequal maternal health care services, gender-inclusive agricultural support for small-scale women farmers, access to loan, and much more, the International Center for Investigative Reporting presents SPARK 2.2, a 30-minute radio program aimed at igniting discussions on these challenges and preferring solutions to them. SPARK 2.2 airs every weekday on different radio stations across Nigeria. Mondays, Federal Radio Corporation of Nigeria, 5 to 5 5:30 p.m. Tuesdays, Anambra Broadcasting Services, 4 to 4:30 p.m. Wednesdays, Freedom FM Kano and Jigawa, 4 to 4:30 p.m. Thursdays, Prestige FM Mina, 5:30 to 6 p.m. Fridays, Live Radio Ibadan and Sweet FM Abeokuta, 4 to 4:30 p.m. Spark 2.2 is supported by the International Budget Partnership IBP.
Good to know you're still here with us. And if you just tuned in, this is Spark on the network service of Radio Nigeria, brought to you by the International Center for Investigative Reporting. We have been looking at basic healthcare provision fund, the realities of vulnerable mothers. Thank you, Philade, for that enlightenment we had before we went on a short break. And I want to ask, how do issues like poor infrastructure, you mentioned poor infrastructure earlier, insufficient skilled staff, and even weak accountability systems, how do they impact BHCPF delivery for women in rural areas?
The moment, in addition to that, insecurity is another
Insecurity,
thing.
yes.
Because there are so many primary care centers across the country now that they are just there, nobody is there again because the health workers working in those places are not safe.
Okay.
And so you have to be alive before you can deliver any care.
True.
So many of those healthcare facilities now, people are no longer there because this insecurity situation in the country has really affected the service delivery in those places. And you can imagine, when you have an infrastructure in place, healthcare center in place, but there is no one there to deliver the care.
So what happened to women?
Then what will happen is the maternal and child mortality issues will continue to increase. Women will continue to die during labor. Child under 5 will continue to suffer illness, and the preventable diseases will be causing death in the society just because we don't have the human resources to deliver quality health care to people in the community. And if government alone can improve on this security, and in conjunction with the community leaders, the people in the community, and if the community is safe, health workers will be willing to remain there and to stay there and deliver healthcare services to meet the health need of the people in the community. But the moment the insecurity continue to worsen the situation, nobody will be willing to stay in such places, and we only have the facility there, but there is no human resources to manage to deliver the care.
Yes.
And so if the security situation is improved on, you expect that the aim and objective of BHC Care Provision Fund will be achieved.
Okay.
Then the second thing is that government need to also invest more in the human resources.
Okay.
Because the more manpower we have at the grassroots level, the skilled birth attendant, nurses, midwife, and other frontline health workers, if they are available there, then you know that women, children, people in the community, the quality of life will improve because they are receiving quality healthcare services. And one of the things I want government to also do is to also improve in their oversight.
Okay.
You talk about some of the people who may be charged, some of women who are visiting normal centers, and some of the managers of these facilities are demanding some token from them. But if there are oversight from government keep an eye on all those facilities, their mode of operation, and they pay unscheduled visits to them, it will keep them on their toe, and they will be able to monitor what is going on in all these at the grassroots level. And that's why we really need to strengthen the local government healthcare facility.
Hello, good evening.
Hello, good evening.
Good evening. What's your name and where are you calling us from?
Okay, I'm Glory. I'm calling from Jos.
Glory from Jos. What's your question, please?
Okay, I want to ask, how can private citizens like me have that are not working with government have that access to quality health care?
Okay, thank you so much, Glory, for calling.
Yes.
Did you hear that? How can private citizens?
As a matter of fact, these BHCPF fund is for all citizens, whether you are private or you are working irrespective of where you are working.
Okay.
As a matter of fact, and that's why the fund is available to fund the resources at the primary healthcare level.
Okay.
And that is, they say primary healthcare, that's the first level of care to address the need of the population. So you don't need to be
I think we have another caller.
All
Sorry. Hello, good evening. What's your name and where are you calling us from?
Okay, so my name is Dr. Biobele Davidson, and I'm from Budget Foundation.
Oh, thank you so much, ma. Thank you for joining in.
Yes, please. Thank you. Good evening.
Good evening.
Apologies, I was just trying to also settle in, but how are you? How is it going?
It's going very well, ma. So let me just quickly ask you this question.
Yes, please. Go ahead.
Okay, so can you tell us practical steps that government, health workers, or communities take to ensure that BHCPF truly reduces the financial burden on vulnerable mothers?
Okay. Thank you very much. But I'll just start with saying that
I can hear you. Go on, ma'am.
Yeah.
Hello, can you hear me? Hello. Okay, I think we can continue having network issues.
Network challenge. Okay, so
she's talking about private citizens, how
yes,
they can access.
private citizens is for everyone.
It's for everybody, both private,
or people working in government. It is for Nigerians.
Okay.
For everyone living on Nigerian soil, and so as much as possible, we expect that whenever you need healthcare service, you are all that is expected of you is to visit the nearer healthcare centers, and you'll be profiled. You'll be enrolled to receive a quality healthcare based on the available services on that in that particular facility.
Okay.
At minimal cost or at no cost.
Okay, so what role should states play in increasing counterpart funding and oversight, like you mentioned, to ensure BHCPF reduces out-of-pocket expenses nationwide?
Well, government needs to take oversight. I talk about that earlier, very seriously. All those health facilities, they shouldn't just provide those resources there. People there needs to be monitored. And when we say monitored, make sure that there are periodic check on those who are working in those facilities to be sure that they are actually follow the rules and regulations guiding the implementation of these basic healthcare provision fund to ensure that the process is not abused or some people are taking advantages or doing some sharp practices to enrich themselves. It is very important. That is one. The second thing is that capacity building of staff is key.
True.
So all the healthcare frontliners, front health workers who are working in those at the grassroots level, they need to build their capacity. Train them on the modern technology available, train them on some of the things they need to deliver quality healthcare at the grassroots. That is very important. There are other things is that the government actually need to work with the community leaders.
Okay.
To sensitize all the members of the community. Visits to churches, to religious houses, and to community leaders to ensure that there are publicity, this awareness among the communities, so that everybody is aware that these healthcare services at the grassroots level is free, and everybody is expected to access this care, irrespective of their status in the community.
Okay, so we have a question here from WhatsApp. As a mother, why are government hospitals not giving some vaccines? Private hospitals give. An example is the Rota vaccine. Have been told at my PAC that the vaccine is not available, Rota 1 to 3. How can PHCPF funding help the vaccine situation? Let's talk about vaccines now.
Well,
this person is asking.
As a matter of fact, if there is any place that the vaccine is to be available, different kind of is at the PHC.
Okay.
Because that is the closest health centers to the community, to the individual in the community.
But now this person is saying,
why
is government hospitals not giving some vaccine private hospital gives?
You know, private hospitals are probably established for profit. That is the primary reason. Unfortunately, the government is the one. Government facilities are the one that's supposed to have those vaccines. And as a matter of fact, even these private vaccines we are talking, private hospitals that are having these vaccines that we're talking about, they got it from the private government facilities.
Oh, okay.
Because they don't manufacture vaccine.
True.
It is government that usually procure vaccine, and there is a distribution chain. But you know, we are in Nigeria, and sometimes some people take advantage of the opportunity they have in getting access to this.
So this vaccine,
and that's why some of these vaccines are diverted to private hospitals, and that's why you get to private hospitals, you get it available. Meanwhile, in government hospitals, they are not just there. And that's why I said government needs to improve on the oversight.
Okay.
So as to make sure that they keep an eye on things that are going on in all these healthcare facilities, particularly at the grassroots.
Okay, thank you so much, Filade Olani, for joining us today on this program. Thank you for your insights, and I hope when we call you next time, you answer us.
It's my pleasure to be here.
Many thanks to the studio manager, Ali Yubawa, the producer, Vivian Onoweware, the engineer, Roslyn Aduko, ICT, Jonathan Aina, and the ICR social media team led today by Israel and Vincent. I am Blessing Otoibi. Also remember that BHCPF transforms maternal health by curbing out-of-pocket costs, but sustained funding and oversight are key. Tune in next week for more. God bless Nigerian mothers.